and welcome to your Health Matters. Let's talk. My name is Cleopatra Stali. On this episode, we are discussing voluntary medical male circumcision, or VMMC in short. To help me discuss this topic, we have in the studios Dr. Albert Kaonga, the coordinator of the National Male Circumcision Program at the Ministry of Community Development, Mother and Child Health. Welcome to the program.
Thank you, Cleopatra. I'm glad to be here.
Thank you, Doctor. Just next to Dr. Kaonga is Christine Jango. She is the coordinator of the voluntary medical male circumcision for Lusaka District. Welcome to the program.
Thank you so much, Cleopatra.
Thank you so much. Now, before we get straight into the discussion, here is a clip that we filmed in the Eastern Province where we see the efforts that are being made by chiefs in encouraging their local communities to go for male circumcision. We also interview couples on the challenges they face before they finally make that decision to go for male circumcision. So have a look at this.
We are an area where there is no circumcision whatsoever, no history of circumcision. So there are people who saying, Mfumu, you are in charge of this area, and we have never heard of Mdulidwe. Now, why do you want us now to exercise Mdulidwe? Mulibwanji o baba na mama? Lero takumana lero kuti tikambirana ndipo nkhani zosiyana makamaka nkhani pachinyanja akuti mdulidwe, pachizungu akuti male circumcision. Mwaona konse kuli tenti, mwaonako? I tenti ileta kuti mweo muone mwamene mvuchitikira pa male circumcision. Mwizi wa male circumcision ni banangati kujeko kuti male circumcision ni chinji.
We are not doing fine in our provision of male circumcision in the province. For instance, in 2010, we saw very small numbers of males who turned in for male circumcision, less than 1,000. 2011, we picked up, went to 4,011. In 2012, we sat down, said, but what can we do? We realized that this program is a community-based program, and we need to involve the custodians of the communities, who are the traditional leaders. So we called on for a meeting with them, we discussed with them, but we really had a lot of resistance from them. Many of them didn't accept it to be done in their chiefdoms. Slowly, they accepted it. We are very much glad that this time, traditional leaders actually are on top of the things. They have accepted male circumcision and they are inviting us to do it right in their villages.
I think the male, in the first instance, they use the male organ to enjoy sex. So they were fearful that if they are circumcised, their enjoyment of sex would be reduced. And some feared that they may even lose the erection altogether. These are some of the fears. And to array these fears, I had to tell them about HIV and AIDS. HIV and AIDS. Compare HIV and AIDS and you removing your foreskin from your penis in order to enjoy better life. Yes, we are drinking ARVs. Yes, we're putting condoms and what have you. And if something else comes in, like male circumcision, which will not reduce your manhood, the way you enjoy sex, and you become clean. You can see a lot of men do not even clean their manhood. Some would drink beer, come late at night, they're looking for their wives. And that's how cervical cancer is transmitted. So we have been telling them the chances of you contacting HIV is less when you go for male circumcision.
Sinawera kunoneo nawera kuti circumcision makusogolo vezeniyo fyaka ikulingana vantu kambata vupaya kuma at least yochitishako May to June so nchivintu vezinkhala kubwino. Sapa mbafuta na vimbwa lero pamina hapa. Nditinatikinya hope nani utabata hapa ningachitise na ine lero.
Mwebandani zena? James
Maziopa.
So mulina mayezi yangati?
18 years.
Tukifunika mwaziba HIV status yenye mwachitana mudulide then mwankala safe manje after mudulide it's not a giveaway kuti muzabukona n'abakazi mwagona na uyu nga mwasala umozi ni umozi chabi.
Wanijua mushimusha hapa. Palibe sofuta zinizeni but nimbera kuchabe kuvava.
Ngauza ko banja nzanu bena mena kaindi manta obwera kuno CIRCUMCISION.
Abaninga wauze kama mungama walimbikisa sota na wewe vangachitisheko mbintu vosavuta.
Kairo but iliane twatampira kucha discuss kwale wefe akwewe ati muntu akwata ko mwenso. Especially ne wali no kuba circumcise. Ne wona ale umpo mwenso. Kai balela ndati yo nga bakuchita circumcise nishi bambi balefu. So a problem twale kwata mumutima again. Then kwale bata manje pakuti ukuikala kani 6 weeks no kumana. Nomba ni shule ikala shani. Manje vifyonse fyalisa moneka kwata obviously fit twafikwanisha.
Okay, tutwaba ifine balanda apa echinga cho balelanda. So ina alisa tampoku bapatikisha fefidi. Na sata kabiyeni ifintu kufi sambilisha kusambirira fya peni. Ngatwa ngamwafichi tamone ne abonza balelanda ifine kwanda tibalafwa batatwa munapo umuntu ufwa tatwa pokela po report kwanda tunafwa tumfafa tubachita meo CIRCUMCISION huko batatwa bala munapo umuntu nango mofu. So mpaka abeni beka balisa fika popa mtima wabo kwanda ta kansi the better nkaechta ntiu elo bashire mona kulanda tiba yaisa pano mpepi nomba akwata nomba na chance kuti tuise tufike pano.
Of late, what happens is that there are other programs, government programs running, like the Safe Motherhood. Then there are programs like on the malaria prevention, maternal mortality rate. So during this also as we go around, because normally I get invited through the district commissioner's office, when there are these programs by the government, I'm always invited. So during that time also we do emphasize the issue of male circumcision. So each time an opportunity avails itself, I do personally go and attend such various meetings and emphasize on the male circumcision.
In 2012, we may be interested to know what we did with our efforts. From 4,000 in 2011, 2012 we picked up to 12,000. As we are saying this year, we've gone beyond 12,000. So meaning we are actually progressing. With this help that we are getting from traditional leaders, definitely we are going to succeed in our program.
Ni vinyinji vitangwa pano. Koma message ni mozi. Yakuti kuti tichepesei kwa mavuto viti nao kuno. Muno minzi mona tiriye vinyinji. Poverty ndiye yatulova. Lomba kuti tikepo na matenda soti. Pamene pali tandizo ingawere mkupyolera na male circumcision. Kuti tirekerere soti ndiye kuti tike mavuto pa mavuto bayakine. Nikurupirira kuti mukachoka pano monse mukabawujira yanu kuti kwa munu kwa lomba programu ila ya male circumcision yeyamba.
Thank you. That was a clip from Eastern Province on the efforts that community leaders are making in ensuring that this program of male circumcision is accepted in the local communities. Let me start with you, Dr. Kaonga. What is male circumcision?
Male circumcision is the surgical removal of the tissue that covers the head of the penis or the foreskin. This is an old practice rooted in religious rites. You read in the Bible that even Jesus Christ himself was circumcised. So that is what we call male circumcision.
When we look at the communities in Zambia, some communities practice a certain tradition where there's circumcision. How different is VMMC from the practice in the local communities?
In the northwestern province of Zambia, people have been practicing male circumcision for a very long time. That is called traditional male circumcision. There is what we call voluntary medical male circumcision. The difference is this. Voluntary medical male circumcision is that type of circumcision, still the removal, the surgical removal of the foreskin, that is carried out in a health facility by a qualified and well-equipped health worker. Now, this is provided as a package because the client is counseled before that, and then it is done within a clean, sterile settings, and then thereafter there is also counseling of the client. So this is that's the distinction that is there between traditional male circumcision and medical male circumcision.
So this practice, Christine, has been going on for a long time. Why the push now by the Ministry of Health?
Well, there are some studies that have been done in the recent past where benefits have been discovered. For example, in the reduction of cancer of the cervix in women, and also the reduction of HIV by 60%, that is to the male folk. Once they are circumcised, then they reduce their chances of them getting infected. They're not reducing the chances of them transmitting, but they are reducing the chances of them getting the infection. And then also in children, when a child gets circumcised, they reduce their chances of them getting urinary tract infection. Because, you know, when there's a foreskin, sometimes it gets too tight that you're unable to retract it back. That is pushing it down. So once you're unable to push it down, it will be very difficult for you to clean it. Hence, the dirt is going to accumulate there. So once you get circumcised, you won't have any of the dirt accumulating there because it will be very easy for you to clean it, and hence you reduce the chances of you getting infection of the head of the penis. So basing on those studies, that's why there's been this push by the Ministry of Health.
We now know that the cancer of the cervix is actually caused by a virus we call HPV, or human papilloma virus. So the foreskin, the tissue that covers the head of the penis, provides an environment, a very good environment for a man to acquire this virus. It's a sexually transmitted virus. So when a man is circumcised, the chances of acquiring this virus sexually are reduced. And therefore, the chances of them passing it on to their partner are also reduced.
Who is eligible to go for VMMC?
Anybody can go for VMMC from zero. I mean, as soon as a child is born, he can be circumcised, up to just any age, actually. I must be quick to mention here that for those boys that are aged 7 years or less, the procedure is provided in specific facilities because of the technicalities that are involved in providing this this procedure. I'm saying so because the way we conduct male circumcision, especially in adults, it's done while the client is fully awake. We give something to numb the penis. It's a medicine so that they don't feel the pain, and they cooperate and you do the procedure. It is very difficult to do that in a 2-year-old. You need to find a way to pacify them, restrain them. So this is what is there in the facilities. But anyone can go for male circumcision.
So for children, does it mean they would need to be admitted to hospital and like older people? Because I noticed when we went to the Eastern Province, the medical officers would just go on the ground and they set up a tent and they do the circumcision for older people right there and then. How is it different for children?
Well, for children, the difference is for the neonates, they don't need to be admitted. Where that is in facilities where they do neonatal circumcision, that is for children that are 28 days and below. They don't need to admit them. They'll just circumcise them, and after the procedure, they are discharged. But for those that will need to be put to sleep, especially probably after 28 days to about 6-7 years old, those children will need to be put to sleep. And immediately they wake up, you cannot discharge them because they will need to be observed so that they may react to anesthesia. That is the medicine that is used to put them to sleep. So you need to observe them maybe for a few hours, and then after that they can be discharged. So the admission is not really for days, it's just for a few hours.
So doctor, is VMMC really simple and safe as you put it?
Yes. Medical male circumcision is a simple and safe procedure, especially when it is performed by a well-qualified and well-equipped health provider done in a health institution. The chances of having a serious adverse event are quite low. And this we can see. Our friends in Northwestern Province have been performing the procedure traditionally for a very, very long time. Now we have male medical circumcision, yes, which we do in our health institutions with equipment, modern equipment. It is a safe procedure.
Before we go to the audience, Christine, how has the response been?
The response has been very overwhelming, especially during the campaign when schools have closed. The turnover is very, very good. We have very good numbers of males coming for the circumcision.
And what would you attribute that to?
The sensitization has been very good. I'm sure the public has they've heard the benefits of male circumcision, and they would want to benefit from the male circumcision. That's how come we've had the very good response.
Well, Christine and Doc, thank you so much for making an appearance and sharing your thoughts with us. It is now time for questions from the audience. Audience, are you ready? Yes. Let's have the question from the lady at the back, please.
Thank you. My question goes to the doctor. Nowadays, male circumcision is performed at small hospitals and clinics. I'm just concerned about the competency of the health workers. Are they really qualified?
Before a health worker starts to provide voluntary medical male circumcision services, we do train them extensively. And remember, these are already qualified from college. So when we train them, we just add on to what they already have. So it is safe, and I would like to urge those of my friends, the men who are yet to go for this procedure, to visit one of the clinics where this is being provided, because the health workers there are qualified.
Thank you. My question is directed to Christine. Is it true that MC is an effective preventative measure, or is it just a gimmick to promote certain cultures? Thank you.
Male circumcision is not just a gimmick to promote other cultures. An example is when we look at the studies that have been done in South Africa, Kenya, and Uganda, and also in Zambia, in the Northwestern Province, where we have people that have been practicing male circumcision for a long time. When we look at the levels of people that are infected with HIV/AIDS, they're actually very low compared to these other parts of the Africa or other parts of the world that male circumcision is not practiced. And also the levels of women having cancer of the cervix is also very low. So it's got benefits basing on the studies that have been done. So it's not really just a gimmick to promote other cultures. It's because of the benefits that come out of it.
Thank you. My question goes to the doctor. My friend told me he lost his sensitivity after MC and he thinks he might have lost his sexual potential and fertility too. What is your reaction to that?
That is a common myth. During the procedure, when we are performing the procedure, male circumcision, remember what is removed is only the skin that covers the head of the penis. Nothing more than that. So what it means is the male organ is left intact the way it was even before the procedure began. Male circumcision does not cause infertility, nor does it cause impotence in men. Otherwise, with due respect to our friends who've been practicing this for a long time, I'm sure they wouldn't have gone on with a practice that would make the people there infertile. It is safe and it doesn't cause infertility.
The next question, Doctor, thank you so much.
Thank you. Doc, I hear the healing process takes long and people are busy with work or school. How can one manage to undergo the procedure?
The healing period is in 2 stages. The first stage is that period of time when the outer surface of the wound gets healed. That takes between 5 to 7 days. And at the end of 7 days, what we observe most of the times, the stitches fall off on their own. Then, for the deeper tissues to be completely healed, that takes a minimum of, or an average rather, of 6 weeks. We do emphasize to the clients that we circumcise that they take good care of themselves, because during this period, if someone engages in sexual activity before the wound is completely healed, there are dangers of the wound breaking down. And that comes with bleeding, and the chances of acquiring the virus are actually increased. This is why we are emphasizing that women need to support their partners. They go through this together, and they support their partner during this healing period, because of the dangers if they engage in sexual activity.
Thank you. My question is also directed to Christine. How does male circumcision benefit us, the women? Thank you.
Male circumcision promotes, benefits women in the sense that when a man gets circumcised, they will not be able to transmit the human papilloma virus into a woman. So they'll get that benefit in that they will have reduced chances of getting cancer of the cervix. Then the other thing is, as we said earlier, male circumcision reduces the chances of one, that is a male, getting the virus that causes AIDS, which is HIV. It reduces that chance by 60%. So once these men are circumcised, the chances of them getting the virus is reduced. So once that chance is reduced, then it will also come to the women. They will not be able to transmit that virus because they're not getting it. I mean, the chances of them getting it has reduced, so they won't be able to transmit that virus to the woman. So the women also benefit. It's not just beneficial to the men.
There are so many benefits. In fact, Cleo, I would like to appeal to our women in this country to support all the males in their lives. I mean their spouses, their children, their brothers. Women are quite influential, and we have an opportunity now to make a difference together. The more men we get circumcised, With time, there will be less HIV, if I may put it that way, circulating. And there will be less HIV being passed on to women. So that is a benefit at population level. So it will help all of us. We are hoping, and we have done analysis, that by circumcising a good number of men, we are going to avert hundreds of thousands of potentially new infections in the country. So that is a benefit.
Thank you. My question goes to Doc. My colleagues have been fearing to go for MC. That is a painful procedure and there's a lot of bleeding. How true is this? Thank you.
I don't know why we men are always afraid. If you look at the figures of those going for VCT, more women are have been going for VCT than us men. For VMMC, people fear, yes, you are right, that it will be very painful. Yes, there will be a lot of bleeding. Remember, these health workers providing this service are trained to handle pain before, during, and after the procedure. Even bleeding is the same. Of course, there is no single surgical procedure in the world that will guarantee no pain at all. Tooth extraction is painful. I took my wife to have a tooth extracted a few days ago. Yeah, it's a painful procedure, but something is given before, during, and after the procedure. So even when we perform male circumcision, we inject some medicine around the shaft of the penis so that the penis is numbed, so that nerves do not pass on the sensation of pain, so that you feel that the pain. The minimal bleeding that results is also taken care of. They stitch around those blood vessels that are bleeding, so that pain is, bleeding is minimized. The adverse events, serious ones, are quite rare with male circumcision. And most of the men who have gone through this, they will tell you that they used to be afraid. Now, they even wish they had gone there earlier to have the procedure performed on themselves.
You know, Doctor, talking about pain, when we were in Chipata, I was surprised because there was this client, he went for circumcision, and after that I expected him to go straight home. But he just went outside and joined his friends, and they were chatting, and we were with him for 3-4 hours after that. And I kept asking, isn't he feeling pain? He was just acting normal, like he just went for a drink and came back.
Yeah, the secret is something was given to him around the penis, yes, so that he doesn't feel pain. And in his pocket, I'm sure he was carrying some tablets of painkillers, so that when he goes home, he drinks for maybe a few days, so that he doesn't feel the pain. So that is the secret.
So it is as simple as that. You don't really need to be in bed? You don't need to be bedridden after circumcision?
After circumcision, we encourage that people take some rest. Of course, if you want to go and ride your bike after male circumcision, we'll say, no, please don't do that. Because we want you to properly take care of the wound. We usually advise that you rest for about 3 days, yes, before you can go for work or you start physical activity.
Dr. Albert Kaonga and Christine Jango, thank you so much for making an appearance on our program today and sharing information with us on male circumcision. Thank you so much.
Thank you, Cleo.
And to the audience, thank you so much for your participation and for your questions and for spending time with us on this program. Well, that's it. That's the program. Your Health Matters. Let's talk. Until next month at the same time. God bless you.